Do you think that, Catherine, that through awareness of premature ovarian failure, we are also becoming aware, and illnesses like it, we're also becoming aware of the fact that how important the regulation of our hormones are as women? Because it's not just like, oh, you can't have a baby. It's also, like Nicole said, all of the organs that break down, all of your risk of osteoporosis, all of the, our hormones, whether you're a man or a woman, they're kind of like our backup generator system. And they make sure everything runs smoothly and everything runs evenly. And if for some reason or another those hormones are gone and you don't know they're gone, so you don't know to start supplementing with something, or to, go and get tested and find out what levels are not right, you can wind up in some serious shape before you ever get diagnosed. And a lot of times, once we've done something, it's irreparable, and we can't. It's a lot of things we can go back and fix with medication, but a lot of things can't be fixed. Once the damage has been done, it's been done. So do you think it's kind of raising a global awareness of how important hormones are, period?
Sheena, you just said in a nutshell why all of this is so important, and we thank you so much for having that PSA, because women tend to think that if they can't get pregnant, that is the be-all and end-all, and they forget about the basics of health, and that is so important. And coming on shows like this and the PSA, I hope that it gets the awareness out, but I think still it takes longer than 2 years to get a diagnosis. It's down from 7, which is a fantastic feat. But 2 years for a diagnosis, when women go to see a physician and they're told, oh, honey, with a little pat on the hand, it's okay, you haven't had your period, you're just under stress.
Yeah,
so it's getting the information out there.
Right.
Yeah, that's the classic. Well, the thing is, you pointed out, hormones, the tiniest little amount is so, so powerful. And hormones include, your insulin, estrogen, progesterone, your endocrine system. The tiniest little amount is so important, and it reacts in everybody in different ways. And then the bone health and the heart health as you get older is huge, because if you have ovarian dysfunction or complete cessation at a really early age, you're not producing the hormones that would be normal for your body's development and, the normal trajectory of your pathophysiology for your life. You never reach peak bone mass. So if you never get to the peak, you're already at, behind the 8 ball before you even start. I mean, that's just one example. So there are far-reaching implications to not having proper hormone production at a young age.
Yeah. I agree. And, I went through it with having endometriosis for years, seeing my friends that also had endometriosis, going in puberty to these gynecologists. That solution was, okay, well, one bit of endometriosis, now it's hysterectomy time. And I remember as a kid when I was having problems, and I had problems from the minute I started my period. I mean, I was a 12-year-old that was like on the heating pad for 3 days. And I remember my mom had a friend who had the same thing happen with her daughter and went to the gynecologist and ripped it all out. And the same thing, like I was saying, it was, well, now you can't have kids, so oh well. But it wasn't like the effects of what that does to your body to lose all of your hormones at 12, 13, 14 years old. And she had sought out my doctor before I got there. And that she said to my mom, look, you know what, this is after my daughter already had the hysterectomy because we didn't know any better. This is the doctor we took her to, and this is where you should take your daughter. And literally every time I see that man, I tell him that, we're coming up on our 30th anniversary, and I always tell him that he saved my life. And I just told him that last month. And just so you girls know, I had a little chat with him about the premature ovarian failure show, and he was very up on it, and he knew all about it, and spoke very intelligently about it. So I think we need, and he's nearly 80 years old, so I think we need more doctors like that who are staying up on the new diagnosis, staying up on the new procedures, because I can tell you it was his awareness of endometriosis that saved my system and saved me a lot of problems that I would have been going through had I been on artificial hormones since I was 12. So, bless him for that. And more doctors need to hear shows like this and talk to you girls and spread awareness that, the answer doesn't have to be a myriad of problems. The answer can be awareness and then treatment right away. So, Nicole, What kind of things did you experience for not being diagnosed for 9 years? Because that's a really long time.
Well, by the time I was diagnosed, I was definitely osteopenic, and I think that's what affected my teeth in terms of cracking 5 teeth. I was on the buy 10 get 1 free plan with my endodontist for root canals, and bilateral plantar fasciitis. My immune system didn't seem to be working as well. I was always sick. My cholesterol was at all-time high of 274. It's down to like 150 now. But it's a lot of it's attributed to the lack of hormones. I tell people a good way to look at POF is like being a type 1 diabetic. They need insulin for their body processes. We need to replace our hormones so our bodies can function as optimally as possible.
Wow, so because in your 20s, when we're still building our bones, you had a lack of hormones in your body that you didn't know about, you developed osteoporosis, and then your teeth are technically bone adjacent, so they had the same effect as the bones where they became brittle and cracked, and that's all stuff that you can supplement with, but certainly you can't get your teeth back, and they're things that you lost because you didn't know what was going on inside your body.
Exactly. Well, actually my bones luckily they're strong again, and my teeth are strong again, and that's due to the hormone replacements and exercise and supplements. So
that's fantastic. And what about you, Suzanne? Did you have problems that stemmed from not diagnosing or misdiagnosing?
I didn't go as long, and I was considerably younger. You know, youth gets you through a lot. I was also a professional dancer, so I was doing a lot of exercise, but interestingly enough, at one point, I'd say around 30-ish, I did end up osteopenic. Osteopenia is the precursor to osteoporosis. So you're in the normal range, then you're in the, it's getting to be a little low range, which is osteopenia, and that's a warning sign, and then osteoporosis. So when I was declared osteopenic, I did go on the biphosphonates, the Boniva, if you've seen Sally Field's ad, or one of those like that, for a year. Started taking calcium supplements and started doing, very pointed, weight-bearing exercise.
And I would be willing to bet that osteoporosis and bone loss is not nearly as fun as Sally Field makes it seem, because she makes it seem like there should be an osteoporosis theme park.
Yeah.
She is really excited about it. She is sitting out by the lake and having sweet tea, and she's just grinning away like a mad woman about it.
She's excited about the paycheck. Let's be real. Come on, Sally. We get it.
Exactly. Where's the paycheck for you girls for that?
Well, my paycheck was I actually reversed mine, and I am still in, for my age, I'm still in the good zone. So I keep up the good fight. And
Catherine, what about you? Did you have a lot of problems leading up to your diagnosis?
No, I was one of those people who seemed like one day I was perfectly fine, and the next day there was something wrong. And my biggest adjustment actually was going on to hormone replacement therapy. I had, like a number of women, had a lot of trouble just finding a dose that would work for me.
HRT is a must-do. It's not, it really isn't an option. I know a lot of people, I don't know what I want to do. A lot of people get put on birth control pills, which is a good start, but it's really nowhere near the levels that you need to replace.
Right.
I would agree, definitely. Yeah. You need to be on HRT. I just happened to have one of the unfortunate experiences, but stayed on the HRT the entire time.
Well,
God bless HRT.
Like I think Nicole it was that said that either Nicole or Catherine, one of you said that it's like being diabetic, and it's the same thing. My mom is diabetic, and I've seen her, struggle for 20-something years with the constant flux of her amount of insulin always having to be changed. I mean, sometimes it's this, then she gets 10 years older and it's this, and then it's pills and shots, then it's shots. I mean, and checking your blood every day to make sure you're in the right place, and you really have to, it's something you have to keep up because hormones are the same way. They're like insulin. They're always fluctuating inside your body. So you need to make sure you have, it's like the Goldilocks syndrome. You have to make sure you have enough but not too much. You have to be right in the middle. And that's a life responsibility in addition to all of your other life responsibilities, to take on the responsibility of keeping that constantly in check. And that's, I think unless you've dealt with a health problem most of your life, you don't realize what that's about. I mean, I'm always checking because basically how I lost my ovary was I knew the pain was back and I was putting it away because I was doing this play and then that play and I didn't want to deal with it. And by the time I finally got so bad that I went back to the doctor, the endometriosis had eaten my ovary, and it was my fault because I knew the signs were there. I just didn't want to have another surgery. And because of that, I lost a part of my body. So you learn to stay in check. And okay, there's a weird pain. What is that? And check it out. And that doesn't feel right. Or my sweats are really bad. Or I'm not feeling good. Or I just broke 3 bones and I don't know why. And keep checking up and making sure you're getting enough replacement. And I don't think people that are very quote unquote healthy all the time know. That's an enormous responsibility in your life to have to manage that all the time. And it takes up a big chunk of your physical and emotional life and your time. I mean, it's a lot to go through. So I admire you all for going through it. And I think that if the good side is to know that it is manageable and you can manage things and you can get over your symptoms and you can get better. And I think that's absolutely terrific. But I think like one of you said, it is something that you manage from day to day and from week to week and from month to month and from year to year and keep a check on it. So I'm sorry, Nicole, you were going to say something and I interrupted you.
Oh, it's okay. I was just going to reiterate that, yes, taking the time to find the right hormone combination is so essential. I mean, I basically feel better now. I feel as good as I did in my teens. And it's almost like you get to a point where you don't realize how bad you feel until you feel good. And that's how I was. I didn't realize how bad I felt until I started getting the correct hormones for my body, and I'm thinking, wow, I feel so fantastic. This is how it should have been all along, and it is possible. And it did take several tries to get the right combination, but it just feels fantastic now because of it.
I think that's fantastic. And Suzanne, how are you feeling?
Huh? Me? Yeah, I'm fine. I'm good. I'm sitting here listening. No, what was I going to say?
I remember a time from knowing you, Suzanne, where you had a lot of things that were wrong, and you kind of took control of your own life and your own medical career. And before you even decided to go into the medical profession, you took charge of your own case and started telling the doctors, this is what I need, this is what's going on, and carrying your information with you and becoming very informed. Because you kind of have to. I mean, you need to know what's going on with your own body. You can't expect someone's going to take one look at you and instantly fix you.
Oh, yeah. I went through some very dark days. Reaching back to what we were saying just a few minutes ago, I often tell POFers in support group that, yes, POF is a devastating thing to deal with. But I would argue that POFers are in better health than the average person because they have to be so aware and they're so on top of their health care. And so maybe in some odd ways, more of a blessing than a curse. Just a thought. Maybe it's a little Pollyanna, but, it really does push you into taking charge. And you're right. Yeah, I was one of many POFers that have associated autoimmune diseases that go along with. And one after another, things going wrong. I basically got sick and tired of being sick and tired. And I got sick and tired of being mushroom patient. And I won't explain that term if you don't know what it means. But basically, I got tired of being lied to and not fully informed. The healthcare providers can be very paternal sometimes, at least, 20 years ago for sure. Not as much now, I hope. But, we don't need to tell you that. That might worry you. No, you need to tell me everything. Because, you're a grown adult. You need to tell the patients everything. It's up to them to decide what to do with the information. And me being me, because you know how shy I am, party people.